Today is a special Global Café, as I have the distinct privilege this morning of being in conversation with my friend and colleague, Dr. Jane Barratt. Jane is an internationally renowned thought leader in the field of aging. She is a Winston Churchill Fellow and recipient of the Queen Elizabeth II Diamond Jubilee Medal in Canada. She is also a member of Vision Academy and the International Council for Adult Immunization, and serves as a director for Baycrest Health Sciences, where she is the chair of the Education Advisory. I will not attempt to list all of Jane's accolades, as we only have an hour this morning, but I am missing one very important role. For the last 20 years, Jane has served as the Secretary General for the International Federation on Aging. Representing over 75 million older people through the membership of the IFA, Jane has had direct responsibility for the organization's operational performance, quality, strategic implementation, and business development, including leadership at the United Nations Economic and Social Council in New York, Geneva, and Vienna, and the World Health Organization. Today marks Jane's last day as the Secretary General at the IFA. And while I have no doubt this is far from the last time we will see Dr. Jane Barratt in there and advocating for older people, today marks the end of her time at the helm of an organization she has helped grow and shape into an international powerhouse. The IFA is small but mighty, nimble and generous, innovative and passionate, all qualities mirrored by Jane herself. It has been a privilege to work and learn from Jane over the past 5 years, and it is my great pleasure to be able to moderate this final cafe with you today, Jane. I thought we would start at the beginning today. We have had many conversations, Jane, about the many hats you have worn throughout your career, and your path to aging has not exactly been a straight line.
No.
How did your experiences, both personally and professionally, lead you to the IFA and the field of aging?
Look, it's great to be with you today, Anna, and I'm very honoured that you're moderating this session, as a trusted colleague and friend. I have to go back to my family roots. I was born into a working class family in the most isolated city in the world, and that's Perth, Western Australia. And I was one of 5 children, and Dad was a statistician and Mum raised us. And my brother Paul was born with a congenital heart defect known as Eisenmenger syndrome. And Eisenmenger syndrome was a result of vaccination not being available in 1959 against measles, rubella. And so, reflecting back, I was the sibling that watched out for Paul. And so my whole first part of my career was in the area of disability, people with disability. His life expectancy was 9. And every year, I could see Mum more and more concerned and celebrating the years that we had with Paul. He was probably 52 years of age, so he was the longest survivor of Eisenmenger syndrome when he received a heart double lung transplant, and that was the first in Western Australia. So he was a great pioneer, and he's certainly one of my heroes. But part of that young carer role meant that I then went into the field of caregiving. I was president of the association in Western Australia, and that's where I met my husband, Greg Shaw, because he was in the government at the time and overseeing. From that role in caregiving, I travelled to the UK. I was an occupational therapist and then had the great pleasure of doing my master's at the University of Guildford, looking at women who had rheumatoid arthritis and gave birth to babies. And there was a whole conversation about the challenges. And from there, I did my PhD in the field of aged care. And that was back in Western Australia. So it's a long way of saying that I was born into this field. It wasn't something that I was attracted to. I was just born in it. And my mother was, one of those people that was at the heart of family, at the heart of caring. And so I think there's something, not in my genes, but in the family dynamics that I was born into. Very grateful.
Aging, the tapestry of your life, it seems. So Jane, I want to talk a little bit, because again, I think you've touched on it already in a lot of ways, but we've talked a lot about just kind of the importance of relationships in both the work we do, how we do it. Relationships kind of drive us personally, but also professionally. Wondering whether you can kind of talk about, why relationships are so important, and kind of some of the best practices for cultivating those relationships kind of professionally.
We don't survive in the world without relationships, personal and professional. Organizations don't survive without relationships. They don't survive, economically, but they don't survive in growing. And I'm thinking of a prune when I say that. You can get an organization that does their work incredibly well, but they don't partner. And with that, they don't learn. And with that, they don't reach out. And with that, they don't influence policy. So, I've talked with you and the team over many years about the greatest grant proposal is useless if you don't know how to build relationships, sustain relationships, and continue nurturing them. And that's what we do every day. But I think our world is so fast at times, we don't stop and listen. And I look on the call today, and Margaret Gillis and Cynthia and Bill and Jim, and these people that have come into my life as colleagues and their friends. And that's how organizations actually grow and sustain. You really trust your partners, and you trust the organization, because the way that we work in IFA is to bring unlike together. I'm happily talking to geriatricians, but I'd rather be talking with diabetologists if we're looking at improving vaccination. So it's about working together to develop a common agenda and coming to that common agenda from different perspectives. And that's the way that we change policy, but it's the way that we grow as individuals. And that's why this job is nothing short of the dream job, because every single day you've got an opportunity for someone to make a difference in your life with who you talk to. So good practice, it starts with yourself. I talk about the fundamental values of myself and the organization: honesty, integrity, trust, commitment. All of those need to be your banner in everything that you do and say. And so the organization becomes known as that. And my final comment about this is just this unconditional sharing. Nothing is original in this world. And if we don't share unconditionally, we don't move forward in what we do and how we do it.
Thanks so much, Jane. And I think you've touched on an interesting piece. I think those relationships in building sectors, it kind of speaks to the topic of today's session, which is really this idea of working on the edge. What is it about the field of aging that kind of feels like you're working on the edge? And how, again, you've talked a bit about the relationship piece of kind of working on the edge, but what are some other kind of, why do you feel like you're working on the edge, and how do you work on the edge? What does that look like?
I feel like I'm on the edge today, by the way.
Yeah.
But, IFA does work on the edge because we're really trying to understand the nexus between, a very important characteristic of an individual and aging. And it's about pushing the boundaries. It's about speaking the language that is going to be meaningful to the person that you're talking with. So I'll give you an example. And I think Margaret's a great example in interpreting what it means to protect the rights of older people. That is not going to mean anything to a finance minister in South Africa. So Margaret would need to change the narrative so it's meaningful to that person and they can then embrace it. And you've got to change your narrative until they actually understand it. Otherwise, you've lost the relationship. And so it's really trying to interpret information into the narrative that's going to influence policy. So vaccination is another one. We know now that high-risk populations are certainly older people, but also those with diabetes, those with heart conditions, we know that there's a relationship between vision, hearing, cognition. So how do we bring, those people in vision and hearing and cognition together to make sense of a common agenda? So that's what I mean about sitting on the edge, because we will fail many times. Many times. You've just got to know where your safety net is, who is your safety net. And I think it was commented yesterday, in my last time at the office, I'm delighted when staff have wings and they're flying and there's a safety net for them. And that's what we have to do with organisational relationships. We've got to be safety nets for other organisations, and we've got to be present to interrelationships.
Thanks very much, Jane. And you've already dovetailed into my next question, which is really, IFA at its core is an advocacy-based organization. It's a very big question, but kind of what does advocacy really mean? What does it mean to advocate? And what makes advocacy efforts successful?
My definition, my operational definition is influencing, shaping policy. That's what we do in the context of IFA. So how do we do that? We need evidence, right? And then we take that evidence and we package it in ways that are meaningful to our target population, whether it be the government, whether it be NGOs that we want on board, whether it's individuals who are champions. And then what we need to do is take that packages of information and we need to make sure it reaches out across target groups, but beyond, because sometimes we don't know what we don't know about the target groups. And that's why communication in its broadest sense, but also the different channels, that we have to use is of immense importance. So we operate at IFA in kind of like three circles. It's knowledge creation. If you don't have evidence, you don't have advocacy possibilities. And then it's the advocacy, influencing policy, and that can be at an individual level. It can be NGOs, it can be industry, it can be government. And then how do we continue to outreach? So all of our work is built around those three, and much of our work is built around three pillars of prevention, access, equity against the backdrop of the decade.
Thanks very much, Jane. I think a big challenge in the space of aging, and this idea of kind of evidence, and I feel like there's often an implicit association. Evidence means data. We know kind of in the aging world, there's often a real paucity of data. We don't have a lot of data often, or there's not data collection or robust data collection methods. What does evidence generation look like in the context of aging, in that lack of data, and kind of what are some examples for people? What are we looking at when we look at evidence?
I think what I've done in the past is also perpetrated the narrative. There is no data. What are we going to do? We need government to invest in, surveillance, better data collection, et cetera, et cetera. Well, that's a dead end road, I have to tell you, because not in my lifetime, we will convince governments to disaggregate the data by age, gender, culture, etc. Some governments will, and that's going to be important. But we have to create the narrative that says, in the absence of this disaggregated data, which clearly you've got for the rest of the population, but you've chosen not to have it here, then we need to tell you that the policies that you've got, have big holes in them. They're inadequate. They don't speak to the heterogeneity of a population. Long-term care, right? Anybody in their right mind would have expected governments to invest in long-term care post-COVID. No, not happening, right? So then we've got to look at ageism. So to answer your question, we've got to think in innovative ways. Help Age do some great work on voice and engagement. The voices of older people. IFA's focus is really around what policies, at what jurisdictional level and to who, and make the connection. So we've got to understand that evidence comes in many forms. So testimonies, policy analysis, the voices of older people. What we probably need to do as organisations is come together and really package all of those innovations into something that's going to be meaningful for government.
Thanks very much, Jane. We've got a question here from our ever faithful Shmuel. He's asking about the role of community and education systems in erasing stigmas against older people and canceling the status quo in relation to the full integration of older people in our society.
Shmuel, I love your questions every week. They're complicated, they're tangential, to what we're talking about. At the heart of advocacy, improving quality of life, etc., is this bottom-up approach. We can talk about bottom-up and top-down and what's happening, but I can guarantee if 100 million older people, stood up and made a lot of noise about the lack of a convention or the lack of the rights of older people being protected and respected, then governments would do something about it. As community, we can work very hard, but it's vertical advocacy that we need. So we've got to take the evidence that's on the ground and use it moving forward. And there's some very good examples. Help Age, do a lot of work on the ground and move it into intergovernmental dialogues. ILC Canada, ILC UK, IAGG. But what we don't often do is do it in an integrated way. So perhaps we can take our own criticism and be more integrated in that approach. Thank you more.
Jane, you touched on one of my favorite things that I've learned at the IFA, this concept of vertical advocacy and horizontal advocacy. It's now a part of my lexicon, but admittedly, it was not for a very long time. Wondering whether you can kind of speak a little bit about, what vertical advocacy means and what horizontal advocacy means and what that looks like in practice.
Yeah, it's a great question. And I think I made it up one day when I
think so too, because at one point I tried to Google it, I think.
I think that's a Jainism for sure, because I couldn't understand how to describe what we were doing. And really what it is if you think about the work at the WHO or UN or OECD or those things, what we do is we hook on to a reference point. So one of the reference points is the decade or the Immunisation Agenda 2030. And our evidence is hooked into what's going on in the intergovernmental agenda. So a terrific example happened in the pandemic. WHO were writing technical guidelines by lots and lots and lots. There were hundreds of them. And one day I thought, I don't even know whether they're doing anything on older people. I've got no idea. Got no idea. So what we did was we analysed the first 75 technical guidelines and we categorised them all and realised that there was very little on older people and very little on older people and immunisation and less on long-term care. So we packaged that analysis up and sent it upwards vertically to WHO. And that action then precipitated a portal for technical guidelines on what was happening with COVID and older people. So that's how we work. Reference, what's the reference point? What's the evidence? And we've done that a lot, Anna, with vision, hearing. We're always trying to make this connection between the technical units at WHO. Hearing is one part of a technical unit. How do we link it to the decade? Horizontal advocacy, I interpret as what we're doing, at a country level through organizations. So, we will gather evidence in Germany around a particular issue, and they will convene an expert meeting of NGOs in that country and hand the evidence over and facilitate meeting. So that's the two differences. But I think it's a Jainism, unfortunately.
It's a helpful way to understand it for me. I think, Jane, again, we've talked a lot about, aging is big. There's, I think, again, because of the intersectional nature of aging as an identity, the challenges are endless in a way. How have you gone about kind of identifying what priorities you want to tackle and kind of work on, and what kind of, we don't necessarily have the capacity or capability to work on?
I hope I haven't got too many directors on the board. I can see Cynthia on the board. In the last 10 years, I've understood with laser precision what IFA does do and what IFA doesn't do. IFA will never be able to lead on poverty, lead on violence, we will support all of these issues. But what can IFA do? What is our niche? And it's this making the connections between senses, vision, oral health, vaccine, and aging. There's a gap in this connection, and it's impacting policy. So we certainly look at the SDGs. We certainly look at the intergovernmental dialogues. We, because of our relationship with WHO, clearly, the 14th work program is going to be very important. And, but in this current work program, our triennial plan of work with WHO links to those. So we have, I think about it in terms of, the incubator phase and the ecosystem in IFA. So the incubator phase, a good example is oral health. We know that that's critically important. We know that there are access issues, there's treatment issues, there's barriers for older people to be have good oral health. That impacts nutrition. That impacts resilience, physical capacity and capability. So I'm always trying to look at what are the consequential factors, of a particular area. So, of course, the next Secretary General, Dr. Anjali Tripathi, and I'm delighted that she's with us today. Anjali will, look at, the plan going forward. It's about, what's possible. Do we have the capabilities and do we have the capacity? And of course, then, where are the funds to make that happen? So we really have a very important role in the intersection of, it's about function, isn't it?
Yeah.
Yeah.
Thanks, Jane. Again, touching on this incubator idea, the adult vaccination portfolio has really expanded, certainly in my time since I joined the IFA. Can you talk a little bit about kind of, the adult vaccination portfolio from that incubator phase to where it is now, which is kind of probably one of our more robust portfolios at the IFA?
Yeah, look, there's no question that IFA is one of the leaders in understanding barriers, opportunities, challenges to ensure a comprehensive vaccine schedule. And this story may amuse you or shock you. The reason that we're in adult vaccination is because I was asked to step in for Alex Kalash at a conference in Prague when he wasn't able to do it. And it was on vaccination. And I knew nothing. I absolutely knew nothing about vaccination. But as we often do, we get up there and we do the best we can to make sense of something. And I could make those relationships. But the statement that I made there is that, and I can see myself now, I'm ashamed that IFA is not involved in this. And that will change from this day forward. And then Jack Waters, who passed away some time ago, talked with us about the World Coalition on Adult Vaccination. So we've been involved in this for more than 12 years. And the reason, because there is such an intersection between being vaccinated and healthy aging. So in the latter half of life, significant high capacity, declining capacity, significant loss of capacity. So vaccination is a winner. It's the second most effective public health intervention, only to water.
Thanks very much, Jane. A big topic of discussion for us over the last, really 3 years has been the UN Decade of Healthy Aging. You were recently, announced as one of the 50 Healthy Aging 50. I'm curious to know about kind of what has IFA's been approach in integrating kind of some of the decade action areas into our work streams, and what's the strategy around that?
Everything that we say and do is through the lens of the 4 action areas and the 4 enablers. That must be our pledge going forward. And the reason that I say this is that we will never get this opportunity again. There will never be a second decade of healthy aging, right? And so we're now in the 3rd year of this decade, and the progress is not fast. So when we talk about IFA's work, it's through the lens of long-term care, age-friendly environments, ageism, and integrated care. And then we use the enablers such as voice and engagement, leadership and capacity. So in all of our policy papers, all of our grant proposals, we have the decade in there to make that connection. And that's why we did this very big study in 19 countries on long-term care, because we wanted to understand what vaccination policy was going on in long-term care, or was it in national aged care plans? And not surprisingly, it's incredibly poor. And so that's the way we operationalize the decade and are heavily involved. You'll see on all of our slides, the decade partnership costs nothing. We should be there. So that's, and of course, promote and push everything that the WHO does around the decade.
Thanks very much, Jane. We've talked a bit about kind of this concept of functional ability, and it's really kind of at the core of how we frame a lot of our issues at the IFA. I'm curious to know kind of, what role functional ability plays in kind of this idea of aging well, healthy aging, and what it means to age well.
It's a really loaded question, isn't it?
It is indeed.
Yeah, look, the way that I understand, and we can do definitions and all the rest, but I think we've got to see the person and the environment. We can talk about social determinants, and they're certainly underpinning this notion of the person and the environment. But the phrase that we constantly use, Anna, is what we need to be doing is creating an environment that enables an older person to do what they have reason to value. Now, we can take that and talk about a long-term care situation. We can take that and talk about employment. We can take that and talk about, older healthcare workers. And so, the definition and the process of developing and maintaining functional ability is exactly the person and the environment. And that's what we need to be talking about and framing our grant proposals and perhaps the rights conversation, across that, latter half of our life.
Great. Thanks very much, Jane. Now, a bit more personal, I'd love to know kind of like what you found as the most challenging part of your role as Secretary General over the last 20 or so years, and what's been the most exciting accomplishment?
Challenges turn into excitement and accomplishments. There is no question that there are challenges. We just, we're human beings, and something will sideswipe you one day, but it will give you strength the next. NGOs, traditionally and will go in the future. We're always trying to nickel and dime things. Where's the money? What can we do? And all of us nickel and dime. If we had $10 million in our bank account, that's a whole different ballgame. And that's why we've got to be laser focused in what we do with the capacity that we've got. So I couldn't sit here and say it's been a dream ride, because money, makes the world go round as much as relationships do. And I'm sure I've told some of you this story, but, Greg and I had only been married, less than a year when we arrived in Montreal, and it was -27. Greg had never seen snow when I went for the interview. And so we embarked on this 2-year sabbatical to Montreal, which turned into 20 years. So there have been challenges. It's very difficult, as you would know, to have family who are ill and dying and passing away when you're not there. So there's really personal challenges. What's been exciting? This is an ageist comment, but if I was 30 years younger, then I'd have another 30 years at IFA. Why wouldn't I? Because it's a dream job. It's a roller coaster, and it enables you to really drive some agendas, not independently, but with, colleagues, friends, organisations. We're really at the cliff, aren't we? This UN Convention on the Rights of Older People, and I acknowledge all those on this call, that are really at the forefront of driving that. And I've mentioned Margaret and Cynthia, and there's many others, but, the dialogue around healthy older people is not getting stronger, so we really do have to push it. I and Greg, I'll talk for me, Greg. It's been, often people say, this is your legacy, and I will continue to say that. I've had the great privilege of contributing to the canvas of the life of IFA, and that's what I've done, and I've done it to the best of my ability. Have I done everything right? Oh no. Have I said everything right? No. But at the time, I've tried my darndest. And have I upset people at times? I'm sure I have. But what I try and do is to give life to an issue, to work with others to drive the issue. But I'm not the driver. I have a team of superb individuals that I have just the honour of working with. The team that we have at the IFA now, just extraordinary. And so, I'll look forward to seeing where they fly within the IFA. But we've achieved a few things, but there's much more to do, and we do it in partnership.
Thanks, Jane. One more question before I turn to the audience. But really it's this, again, we've kind of talked about challenging the status quo a little bit, and that's not always comfortable. That's not always an easy thing to do. That can be really challenging and requires at times a level of, the kind of critical friend. How can you, what does it look like to kind of to challenge and push boundaries? And how do you do that in a way, knowing that there's always going to be kind of tensions at the boundary of anything?
You've got to be your own critical friend to begin with. You've got to be truly and brutally honest with yourself. I think that's the first thing. I think the second thing is that, what I've tried to do is, with the evidence that I've got, position an argument or a statement and stand by that. I think sometimes that we try and have it all, have everybody's opinion. Sometimes consensus just doesn't work. We hope it does, but it doesn't work. So I talk about being courageous and bold and positively disruptive, because that's really, I still think that's what's required going forward. It's not about fighting the good fight. It's about bringing organizations and people along with you. That's what's required. And I often sit in discomfort. And I often talk about the stability of instability. And that's where I've been all of my career. So an organization that requires input, is really buffered geopolitically with issues, then what we need to do is be comfortable with the instability of the work that we're dealing with.
Thanks very much, Jane. I now have a question from our colleague, Katrina Buzanis. Katrina, would you like to come forward and ask your question?
I don't think that's fair.
I think it's the first of many, Jane.
Yeah. Thanks, Anna, and thanks, Jane. I've worked with you so closely that I've seen the work ethic that you have, and just, you really show up every day, and not every day is exciting, even though you're making it sound very exciting, but some days it is just you in your pajamas kind of at your desk. So I'm curious, what over 20 years, where does that work ethic kind of come from? And even on some of those days when, it's hard, it's challenging, or even sometimes, you just have to sit at your computer, where does that kind of motivation, inspiration come from?
It's a great question. It's because it's not about me. It's about the organization. It's about the people. And I've often talked with you and staff about there is no such thing as work-life balance. And there is balance, but there's not work-life balance in the world that we live in now. And if we thought that there was, we're wrong. But I think every individual has to get what they understand as balance. And by the way, I don't have it at the moment. But for me, it's about the organisation, but most particularly in the team, Katrina, it's what do I know that could be useful for the team to learn? That's really important to me. And if it means doing 6 reviews and working, then that's what I'll do. But please, no one on the call do what I do, because I don't have work-life balance. But it's about showing up for yourself, but showing up for other people. But you do it anyway, Katrina, every day.
Thanks, Jane. We also have a great question here from our lovely UN colleague, our UN IFA rep, Cynthia Stewin. Cynthia, would you like to come forward and ask your question?
Sure. I'll get teary if I do too many things, so I'm not going to say those. What I really want to know is, what are your aspirations for the next phase of your life? And I'm sure that includes Greg, but you can't speak for him.
No, I won't. I'm going to be irresponsible for a while. I think that's really important, and I don't know what that looks like. And I have the great fortune of continuing some work with the IFA as a global advisor. And I'm looking forward to that in very particular pieces. And the third thing is that I'll be doing some consultancy work. So I never thought I would do that, but I've got too much to learn and too much in my head to stop. The only other thing that we're doing is Greg and I are buying an RV and going to travel the world. So we're going to do that too.
Thanks, Jane. Next question, again, a really interesting question from Roxana. Roxana, would you like to come forward and ask your question?
Yes, absolutely. I have had the great privilege of working with Jane, and I cannot say enough. Empathy is really at the core of everything you do, in that personal aspect. And it's something that sometimes when I work with others, I struggle with to always keep that in mind. And how do you always make sure you keep the person first, the person's need? And I know sometimes we talk about person-centered approach, but I see you do that even in the way you work with others and that interdisciplinary component. So I would really like to kind of know a little about that aspect.
Thanks, Roxana. What a great question. And you're hearing all kinds of personal stuff from me. Roxana is the cause of my nails, which look really nice now. So Roxana grabbed me one day and said, we're going to get our nails done, which was a first to me. And I tell you that story because it says something about Roxana, but it says something about me, who is not very good at accepting things. So the word empathy, whenever I talk to someone, I'm actually genuinely interested in who they are. Who are you? Tell me a little bit about yourself. And so it's quite common for me to know how many children, names of children, because people actually want to be listened to as human beings. They don't want to be listened to as just the CEO or the this or the that. And I also absolutely believe that the person, their family come first, second, and third, and then the organisation comes next. So we really, I always need to come back to what's really important in this life, and it's human beings and relationships with one another. That's at the heart of what our life is and should be.
Thanks very much, Jane. And thanks, Roxana, for the question. Now a question from one of those lovely, trusted colleagues and friends, Margaret Gillis. Margaret, would you like to come forward and ask your question?
Sure. I want to just start by a quick anecdote. I started in aging as the director at Public Health Agency of Canada on Aging. And about a month into the job, and I knew nothing about aging, by the way, Jane and Greg came into the office to make a pitch on some partnerships with government and IFA. And I sat and listened to it, and Greg and Jane left, and I turned to the colleagues at the table and said, why aren't we joining them? And they said, well, we don't know. I said, well, go get them. We'll tell them now. And they ran to the elevator to get Jane and Greg to tell them that, yes, we wanted to partner with them, and they had already left. But anyway, best deal I ever made was working with Jane and Greg from the get-go. And I have always trusted Jane. And so I'm going to squeeze the last little bit of time with Jane with a question, which is we've all of us in the field, including IFA and ILC Canada, have just responded to a call from the co-facilitators at the United Nations who are looking at the gaps in the rights of older persons. Canada's response was very thin soup and didn't even really address the main issues in terms of talking about the problems and gaps in the country. You know, there was a list of issues. We all put time in and thought into that. They gave some, they didn't even address them. They kind of gave a short shift to it, and then kind of went on to say there really aren't any gaps, which we all know is not true. So any advice for us on going back as you on your last day?
Yeah, this is political. Let's be real.
Yeah.
I don't care whether we had all the evidence in the world. This whole issue around a convention, which is now in its 14th year, you know, the open-ended working group, is political. And unless we get political, it's not going to shift. And that's really the bottom line for me. And it will mean getting political, you know, in a number of different countries to shift it. Because we will always have light on evidence, and we will always listen to member states that colourfully tell us that everything's okay in the country. So you're a very powerful advocate, Margaret, and you know politics. So get a few politically minded people. You know, Francis Xanadin would say, we actually need to start shouting. Well, you know, the shouting should have happened a long time ago. But I would say this is a political issue, and NGOs need to be political.
Thanks very much, Jane. I guess, my own follow-up question to that is, what does that look like? What do you mean when you say, or kind of what can individuals and organizations be actively doing? Again, it's a big year for the UN Convention. I think we can all agree that it's important. What can we tangibly be doing to kind of help drive that forward?
About relationships. It's about, knocking on the door until you actually get a meeting with the minister. And it's about many organisations knocking on the door until you get a meeting with the minister. Because if they feel the pressure, from the constituents, then they're more likely to do something about it. If they don't feel the pressure, and we see it all the time. In Australia, there was the sexual abuse of an older woman some years ago. Overnight, there were policies, police clearances and everything, because it's bad press. So sometimes policy development and conventions, don't go in a linear fashion. And so, the work of ILC and others, Gareth, has been very strong, but it still needs tight coordination, and, what's the one goal? The one goal is get to the minister. How do we do that?
Thanks very much, Shane. I have another great question from Katrina. So I'm going to ask Katrina to come forward and ask her question.
Yes. So Jane, I guess for those of you who don't know, I work, quite closely with Jane in the vision health areas of IFA's work. And one thing that I've seen is, Jane is often in a room full of retinal specialists and ophthalmologists, and nobody knows about aging. And Jane is sometimes the only civil society, the only person who is, thinking about older people, thinking about aging, thinking about kind of, more of that person-centered lens. And so I'm just kind of wondering, first of all, how do you not feel kind of like an imposter syndrome in that room? But also, how do you bring, your perspectives and IFA's perspectives to the table in situations like that? Because we're truly in situations like that all the time, especially, with like you've talked about, bringing kind of unlike together. And, oftentimes we are the only aging organization at a table of, hearing experts or vision experts or age friendly or things like that.
Yep. Look, I'm quite nervous a lot of the time, but that doesn't stop me, because I have a fundamental belief that older people need to be part of the conversation. And so at every opportunity, if there's a paper that I'm contributing, I'll go, where is the patient in this? And so, you would notice, Katrina, the retinal specialists now go, oh, where is the patient in this? So it's been the trickle feed, because, that's what we need. I think I said to the staff yesterday, do not let anybody suggest that you are not who you are, because you are the experts. Believe in yourself, step forward, because all of you can do that. We don't need to step back and wait for the conversation. We can say, where are older people in this conversation? So it's courage. It comes back to, and probably a little bit of tenacity. All right.
Tenacity, a word I would use often when speaking of Jane, I think.
Yeah.
Dovetailing off of Katrina's question, Jane, in a similar thread, working internationally is quite different than working at a national level. And oftentimes we deal with, very different priorities, very different political agendas, even different definitions. I look at long-term care. Having that conversation in Canada has been really different than having that conversation in other regions of the world. How do you what are some of the strategies in creating a common agenda at an international level?
You've got to know what you're talking about and say it exactly the same all the time. And be known to that, be known as that person that will ask questions and be curious and inquiring. And, you know, ask those questions in the room, at coffee breaks, at dinners, at what did you think about this? Why wasn't this here? Because the agenda of older people actually falls off the table more often than not. And so we just need to get it back on again. But we need to get it back on again and communicate it in a different way that is actually meaningful to that person. So international work is not challenging in as much as you actually need to interpret the language and push the agenda.
Thanks very much, Jane. We are quickly approaching the hour, but I have a great question here from Matali, which I think is a good way to lead into the end of our discussion today. Matali, would you like to come forward and ask your question?
Hello. So Jane, since I've known you, you've always provided, such great wisdom with everything, any kind of work we do, if it's little, small, whatever, everything in between. So I kind of want to know, like, someone trying to enter this field of aging, no matter where they're coming from, what kind of advice would you give them? And, how can they kind of keep that momentum going so that they can continue some of the boundaries that have already been, established by a lot of people, such as yourself?
A great question also. I think first and foremost, Matali, we need to share unconditionally. We need to step forward. I often used to have phone calls when a funder would say, can you do this? And I would say, yes, of course. And then get off the phone and think, how am I going to do this? And it's about taking that step, because you've got the aptitude and the capabilities to do it, but you just don't know quite how at the moment. The field of aging is vast. We have not touched, what's required in good policies at a governmental level. If I was entering the field now, I would really be sure of understanding this latter half of life, significant high capacity, the notion of prevention, access, equity. That's going to be pivotal to the future, because that can then speak to health system reform. It can speak to public health interventions. It speaks to labour market forces. It speaks to, healthcare workers. So there's such a vast array of topics and angles that work to improve the lives of older people. And that's from, high capacity all the way through. And then you've got really important areas of science that we're looking at. I was sitting next to someone last week, and he was telling me that, if you exercise 30 minutes after being vaccinated, your antibodies actually increase. Now, wouldn't that be great to be in the public arena? We know that vaccines and dementia, is being vaccinated, there appears to be a reduction in inflammatory response. So, this aging field is vast, and we should be dipping into all of those areas that make the connection to improved quality of life.
Thanks very much, Jane. I'm going to give you a couple moments before I come back to you for some final thoughts. And in the meantime, I'm going to have Bernice share our tile for our last Global Cafe of 2023, which will be looking at the importance of health policy and systems to strengthen rehabilitation for older persons. And we'll be talking to Professor Walter Frontenera. Katrina will be moderating, so it's going to be a great session. So we look forward to kind of you joining us one last time before we move into the holiday season. Thanks very much, Bernice. So Jane, we've again, the hour seems to have flown by once again. I have two questions for you. The first, what are you most excited to do as you kind of move into this next chapter? And two, what piece of advice would you leave all of us as we kind of continue, and we'll continue this alongside you, I know, but continue kind of advocating for older people around the world?
Thank you. It's a great pleasure to have been with you today. I was quite nervous, but I think it was a good thing to do. Before I answer the questions, I just want to say a couple of things. There's a person on the Global Cafe today that Greg and I owe a tremendous amount to. His name is Dr. Joel Satterboy. Without the support of Dr. Joel Satterboy, the IFA would not be in Toronto. And being in Toronto and having the space that we had and we have now is because of Joel Satterboy. So it's very likely that Greg and I would not have continued. And so I want to say, Joel, thank you. Thank you for your kindness and generosity, you know, for your expertise, your faith, and your continuing friendship. It means a lot to us. So thank you. To all those staff and board that I've had the pleasure to work with, it's been an immense pleasure most of the time. Not all of the time, but most of the time. So thank you. To the colleagues and friends around the world, I will continue to be in this space and happily join with you. I'm excited to really focus on some specialty areas, you know, in the field of aging, and be advocate, do some consulting, and really put my mind to reading papers and learning new areas. So that's an excitement to me. I think the other thing that I'm going to look forward to understanding is how to sleep. Sleep could be quite important for me going forward. And understanding, I don't know who I was talking to, Dr. Dupree, Amy Dupree yesterday. I said, I'm not sure what I like to do. I'm not even sure what I like to eat anymore. The IFA has been a consuming part of my life. I've loved it, and I'm very happy that the reins will be handed over to Angela in the coming weeks, and I'm very happily to be part of it. But thank you very much. Greg, did you want to say a word before we close?
Jane, all I can say is that's my girl. That really is my girl. She's an amazing woman. Always has been, always will be, always in my life. Thank you.
Okay. Now that really
Thanks
does.
for that at the end, Greg.
Feeling of emotion.
Okay. All right. Look, thank you very much. And we'll be in touch. I'll send you my other email address as well. But thank you. It's been an enormous pleasure to be with you today. And thank you to the IFA staff for pushing me to do it. I wouldn't have if you hadn't. So back to you.
Okay, well, I'm going to just try to get my stuff together before we close this out for the day. But thank you as always for joining us, Jane. It's been a pleasure. Have a great day, everybody.
Okay. Bye-bye.